We're interested in trying to understand what are the environmental exposures and mechanisms that really increase risk for the development of asthma.
What is exposomics is to understand all exposures, both chemical and social, that we as human beings experience from the time we start to develop in utero all the way to the end of our lives.
It's really a broad term that encompasses how environment influences health.
What's most exciting about exposomics to me as a clinician is, in my heart of hearts, I know that the environment plays such a big part in the expression of disease and disease risk. Flip that over on the other side of the coin, there's huge potential for prevention and intervention.
With our work, we've been able to show that children that have higher air pollution exposures in pregnancy have poorer lung function that's measurable by age 8. We measure air pollution at the participant's home address by using satellite-based models. So we have a whole team of modelers here at Mount Sinai that are able to take data from NASA satellites, understand what the ground level air pollution looks like, and then they're also able to bring in other measures, such as how far away from a roadway are they. So it's incorporating both satellite measures with other neighborhood level factors that may influence air pollution.
Does traffic-related air pollution exposure in mothers during pregnancy have an effect on whether or not that child ultimately develops asthma? We want to really understand the mechanism that's driving that effect once we see it, and that may depend on when during the pregnancy it happens. So some of our work, for example, shows that fine particulate matter, a certain type of air pollution that comes from traffic, has its effect in mid-pregnancy at about 20 weeks to 24 weeks gestation on whether or not that child goes on to develop asthma.
There's not a single exposure that's going to influence child disease. We know that people experience multiple exposures and that multiple exposures will influence a child's risk of developing asthma. What I'm really excited about doing is moving from looking at single exposures to looking at mixtures of exposures. African American children have higher rates of asthma, for example. It's not likely genetic, but due to environmental factors that may be due to social factors.
It's really the social toxins that are driving a lot of those differential risks that we see in certain populations, particularly low-income communities. Worrying about how much money you have, can I pay the rent, making decisions about do I pay the rent or do I buy my medicine.
One of the factors that we study a lot is maternal psychosocial stress, in terms of when you have stress, there are actual biological reactions that happen in the body that can influence the developing child.
When you start to look at the mixture of all the things, including social on one side and the physical, chemical on the other, and you start putting them together, you start to see even worse health outcomes than you would see if you were looking at either one at a time.
What our research is doing is trying to identify exposures in early life so that we can prevent those children from going on to becoming the patients that I'm seeing in clinic.
If we truly apply what's learned, it has the potential to influence child health.
We have the tools here at the Institute for Exposomic Research at Mount Sinai in our laboratory to measure not just 1, 10, or even thousands of chemicals at a time, which is really exciting because then it gets us a little closer to reality. I actually think we'll be able to prevent asthma 5, 10 years from now.